Hi, everyone, and welcome to our Wound Care Micro Session series. I'm Sarah, Director of Clinical Education with Wound Care University. In these short sessions, 10 minutes or less, we'll tackle one high impact topic at a time so you can take a practical pearl back to the bedside today. Today, we discuss skin substitutes, reimbursement, and places of service. The objectives for this micro session are as follows. Define the concept of a place of service, POS, and explain how POS codes determine Medicare reimbursement eligibility and rates. Differentiate between facility and non-facility fee schedules, and describe how they impact reimbursement for wound care procedures and products. Identify key POS codes relevant to wound management, e.g., POS 11, 12, 13, 19, 22, 31, 32, and match each to its corresponding care setting. Apply POS knowledge to real-world case examples to determine appropriate billing and coverage scenarios for skin substitute products. Recognize how mobile wound care services bill based on the patient's care location, and articulate strategies for aligning skin substitutes use with compliant reimbursement practices. Places of service. Welcome to the training on places of service, POS, based on Medicare guidelines. In this module, we will review the different POS codes used in wound care and identify where skin substitutes are eligible for Medicare reimbursement. This module is essential for sales representatives seeking to deepen their understanding of how skin substitutes integrates into a physician's clinical practice. What is a place of service? A place of service code, or POS, is a two-digit code that identifies where a patient received care. Medicare defines 99 place of service codes in total, covering nearly every possible site of patient care. POS codes determine eligibility for coverage based on where the service occurred, reimbursement rates, including whether the service is reimbursed under a facility or non-facility fee schedule. Facility fee schedule applies when the service is performed in a setting where Medicare is already paying the institution, hospital, ambulatory surgery center, skilled nursing facility, etc., a separate facility fee to cover overhead, staff, and supplies. Non-facility fee schedule applies when the service is performed in a physician's office, clinic, or other non-facility setting where the physician bears the costs of overhead, staff, equipment, and supplies. Medicare reimburses more in this setting because the physician assumes all practice expenses. Example, let's say a podiatrist performs a debridement in their office, non-facility. They get the higher non-facility payment because they supply the treatment room, equipment, and staff. In a hospital outpatient department, such as an outpatient surgery centers, they get the lower facility professional fee, while the hospital separately bills Medicare for the facility fee. Understanding POS codes is critical to navigating coverage and reimbursement, since the same skin substitute can have two different reimbursement amounts depending on place of service. Let's go through the key POS codes, what they mean, and examples of each in wound care so you know where reimbursement is available. POS 11, physician's office or clinic, a location where the physician or health professional routinely provides services, typically an independent medical or wound care clinic. This is the most common setting for skin substitute applications. Medicare reimburses both the procedure and the product separately. Example, private wound care practice, a podiatry clinic, or a vascular office. POS 12, patient's home care delivered in the patient's private residence by a visiting physician, nurse practitioner, or mobile wound care provider. More on mobile wound care later in this module. Example, a nurse visits a patient at home to check a healing venous ulcer. POS 13, assisted living facility, ALF. A residential care setting for individuals who require some assistance with daily activities, such as medication management, bathing, or mobility, but do not need 24-hour skilled nursing care. Clinical care is usually delivered by visiting providers or contracted mobile services. Example, a primary care physician visits a patient in their assisted living apartment to apply a skin substitute on a patient's chronic leg ulcer. PUS 19 off campus outpatient hospital, a hospital affiliated outpatient clinic located off the main hospital campus, example, a hospital operated wound clinic in a medical plaza. Medicare reimburses the procedure. The product is included in the facility payment and not reimbursed separately. POS 22 on campus outpatient hospital. These are hospital outpatient departments located within the main hospital complex. Procedures are reimbursed by Medicare, but the product is bundled into the facility payment and is not reimbursed separately. POS 31, Skilled Nursing Facility, SNF, settings providing skilled nursing and rehabilitative care. Generally, Medicare does not reimburse skin substitute products separately due to consolidated billing rules. Example, a patient recovering from surgery receiving wound care in a SNF, POS 32, nursing facility, long term care. Custodial, non skilled care settings such as long term residential nursing homes. Medicare does not provide separate reimbursement for skin substitute products. Example, a long term care facility for patients with chronic care needs, such as those with Alzheimer's disease. Mobile wound care. Mobile wound care involves delivering wound evaluation, management, and advanced therapies directly to the patient's location. Teams may include physicians, nurse practitioners, PAs, and supporting nurses or technicians traveling with portable equipment to provide on site assessments, debridement, dressing changes, limited interventions. Providers bill Medicare based on where the service occurs, not the provider's business address. Patient's home, POS 12, nursing facility. POS 32, assisted living. POS 13, mobile wound clinics are often the first to identify patients who may qualify for graft therapy. You have completed the places of service module. By understanding POS codes, differentiating between facility and non facility reimbursement, and recognizing mobile wound care opportunities, you can engage confidently with physician partners, navigate reimbursement, strategically identify the most suitable use cases for skin substitutes. Thank you for attending this wound care micro session. I am Sarah Holtman. We value your commitment to patient care. We'll be back with another focused topic soon. See you next time.